It's time now for Medical Moments with Covenant Healthcare, and joining us this morning we have Dr. Hooman Norkiani. We appreciate you being here. We're talking about something really important, which is lung cancer, and we should start really with talking about the risk factors.
Yes, so thank you for having me. Lung cancer is the leading cause of death in the United States to this day, and the leading cause of lung cancer is cigarette smoking. Other non-smoking related causes of lung cancer are going to be environmental factors such as air pollution, radon gas, which is oftentimes found in homes. This is a gas that will come from the soil or typically in basements. There's not really a strong genetic association for lung cancer.
Okay.
So typically these are more nurture rather than nature.
But it is important to note, though, so it's not just necessarily a smoker who is at risk.
No, that's correct. We do have cases of lung cancer that occur in never or non-smokers.
Wow. All right, well, what treatment options are available once for localized lung cancer, really?
So treatment will invariably depend on the stage or the extent of the cancer. For early stage tumors, which is what we strive to diagnose, the quicker lung cancer or the earlier it's caught, the more curable it is. Typically for early stage lung cancer, we're talking surgery if the patient is a candidate for surgery, or if not, then radiation that's localized. As the stage progresses, as the tumors get larger or more lymph nodes are involved, we may add chemotherapy to those modalities.
So that would be a more advanced stage.
Correct. So chemotherapy could be combined with immunotherapy, which is a more recent advancement in the treatment of many cancers, including lung cancer, where we harness the body's immune system to help us fight the cancer.
What is it that someone would have? What sort of symptoms? Is this diagnosed when I go in for an annual physical and you listen to me breathe, or is it something that I'm coughing a lot? What do you get?
It depends. So
okay.
Typically in earlier stage lung cancers, this will be silent. There won't be any symptoms. So we rely on screening tests in patients who qualify for them to catch these cancers as early as we can. In more advanced stages, of course, symptoms can develop. Cough, shortness of breath, coughing up blood, weight loss. There's a whole constellation of symptoms that can arise.
Well, you mentioned those screenings. Who exactly should undergo a lung cancer screening?
So different societies will have different guidelines, but there's a lot of shared characteristics between those guidelines. Typically, screening is reserved for patients between the ages of 50 and 79 years old who have had at least 20 to 30 pack years. A pack year is defining the exposure to cigarette smoke. This is multiplying the number of packs that are smoked on average in a day, multiplied by the number of years a person has smoked. So if you've smoked 1 pack a day for 30 years, you have a 30-pack year smoking history. If you've smoked half a pack a day for 30 years, you have a 15-pack year smoking history. So patients between the ages of 50 and 79 will qualify for lung cancer screening, and they should have at least 20 to 30 pack years. And these are patients who smoke currently or who have quit smoking over the past 15 years.
Interesting. And how is a screening conducted? What does that entail?
These are yearly, low-dose, non-contrasted, meaning we don't inject anything into the veins, CAT scans of the chest or CT scans of the chest.
That's interesting. How are positive findings even managed once detected in a screening test? I would assume it would be depending on the level, really, where you're at.
Correct. So we look for nodules, and any nodule that is 4 millimeters or greater needs follow-up. So depending on the extent of what we find, depending on the size, we will either have a pulmonologist help us work this up and find out whether this is in fact cancer or not, and this may ultimately lead to a biopsy or a sample of whatever it is we find that is abnormal.
So someone with concerns should contact Covenant and make an appointment or see their doctor.
Absolutely.
Get that going.
And low-dose CAT scans of the chest for lung cancer screening can be ordered by any primary care physician. And if positive findings were to arise, we are set up to handle those through our lung cancer, or excuse me, our lung nodule program.
Wonderful. Well, we appreciate it. Some really helpful information, life-saving information, really. We want to remind you, too, if you want information on lung cancer and maybe how to get some help, you can go to hot links at the top of our website, WNEM.com. Click on that, and we'll get you where you need to go.